Hi, I'm Elsie. While I was lying in a hospital bed fighting for my life, my boss Douglas sent an email firing me from the company I helped build. No warning, no conversation, just a cold termination notice delivered between my second and third surgeries. I couldn't even hold my phone to read it myself. And 2 months later, I walked into that same building as his new CEO, watched the color drain from his face, and said, "I believe you're in my office." But that wasn't even the most satisfying part. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. Because what came after, the truth that emerged, the allies who stepped forward, the justice that unfolded, it went deeper than any corporate takeover ever could. 6 months ago, I was just a chief operations officer trying to keep our healthcare tech startup afloat while our founder took all the credit. I was the one who built the systems, who trained the team, who kept us operational when funding got tight. I was the one who worked through pneumonia that turned into sepsis because there was no one else who could handle the integration deadline. And I was the one who ended up in intensive care while Douglas was telling investors I was unreliable. The hospital room was cold, not just the temperature, but everything. The lighting, the sounds, the feeling of being simultaneously surrounded by people and completely alone. I remember staring at the ceiling tiles, counting the tiny holes while nurses changed my IV antibiotics. The infection had hit hard and fast. One day, I was coughing in meetings. The next, I was delirious with fever as my body fought something it was losing to. I spent 11 days in that hospital bed. 11 days of texts going unanswered, emails piling up, and meetings happening without me. I told myself it was okay, that the world wouldn't stop because I got sick, that the company could handle a few weeks without me. That's what I'd built. After all, systems that could run even when I couldn't. On day 7, as I was finally starting to turn a corner, my phone lit up with a message from Maggie, our head of HR. "Elsie, something's wrong. Douglas is calling an emergency board meeting tomorrow. He won't tell me what it's about, but he asked for your employment contract. Are you okay?" I wasn't strong enough to call her back. I just sent a text. "In hospital. Sepsis. Getting better. What's happening?" She didn't respond for hours. When she finally did, I could feel her hesitation through the screen. "I think he's trying to push you out while you're down. I don't have proof, but the timing, it just feels calculated." I remember laughing, actually laughing, through cracked lips and an oxygen tube. It seemed absurd. I'd given 5 years to Healthcrest. I'd postponed starting a family, missed my father's retirement party, worked through 3 Christmases and countless weekends. I'd been the one to secure our latest round of funding while Douglas was networking in Aspen. It couldn't be happening. Not like this. The next morning, my doctor was explaining the need for another procedure when my phone started buzzing repeatedly. Notification after notification. Slack messages, emails, texts, all coming in at once like a digital avalanche. My nurse picked up my phone when I pointed weakly at it. "Do you want me to read these to you?" she asked. I nodded. Her expression changed as she scanned the screen. There's an email from someone named Douglas Warren. Subject line, termination of employment. Effective immediately." She looked uncomfortable. "Should I read it?" I whispered. My voice was still raw from the tubes they'd removed days earlier. "Dear Elsie," she read. "The board has unanimously decided to terminate your position as Chief Operations Officer at Healthcrest, effective immediately. Your recent absence has highlighted significant gaps in our operational structure that we cannot sustain as we approach our Series C funding round. Your personal belongings will be packed and available for collection by a designated representative. Your access to company systems has already been revoked. We thank you for your contributions and wish you well in your recovery and future endeavors." The nurse looked up, clearly shocked. That's it," she said. I'll never forget the feeling that washed over me in that moment. It wasn't rage, though that came later. It wasn't even hurt, though there was plenty of that too. It was a strange, hollow clarity, like someone had finally turned on the lights in a room I'd been feeling my way through in the dark for years. "Can you help me sit up?" I asked the nurse. She adjusted my bed, concern evident in her eyes. "Should I call someone for you?" she asked. I shook my head. "No," I said, my voice finding its strength. "Not yet." What Douglas didn't know, what he couldn't have imagined as he smugly clicked send on that termination email, was that his timing wasn't just cruel. It was catastrophically stupid. See, 3 weeks before I ended up in the hospital, I'd received a strange call from a number I didn't recognize. The woman on the other end introduced herself as Nina Reynolds, lead investor at Horizon Ventures. They were considering a significant investment in Healthcrest, she said, but wanted to speak with me directly first. Not Douglas. Me. "We've done our due diligence," she'd explained. "And while Mr. Warren is certainly the face of the company, every industry contact we've spoken with says you're the operational backbone. We invest in people, Ms. Mitchell, not just ideas, and we want to know more about you." I'd scheduled a meeting with her for the following week, but then the pneumonia hit, and everything fell apart. Or so I thought. What I didn't realize, what Douglas never considered, was that firing the person your biggest potential investor specifically wanted to meet might not be the shrewdest business move. Especially not when you do it while they're fighting a life-threatening infection. As I lay in that hospital bed, staring at the notification of my firing still glowing on my phone screen, I made myself a promise. This wasn't going to be another situation where I smiled, nodded, and absorbed the blow. This wasn't going to be one more time I diminished myself to make room for someone else's ego. This was going to be different. I just didn't know how different until Nina Reynolds walked into my hospital room 2 days later, pulled up a chair beside my bed, and said 6 words that changed everything. "I think we should talk about Healthcrest." That was the beginning of the story that brought me here. To this office, to this chair, to the moment Douglas Warren realized exactly how badly he had miscalculated. But I'm getting ahead of myself. To understand how I ended up as CEO of the company that fired me, you need to know what happened next. You need to know about the lies, the manipulation, the pattern that had been there all along, and the power of finally seeing it clearly. 5 years before I ended up in that hospital bed, I was just another software developer with a healthcare background and too many ideas. I'd spent 4 years working at Memorial West Hospital, watching brilliant doctors and nurses struggle with systems that seemed designed to make their jobs harder, not easier. Every day I'd watch them fight against clunky interfaces and siloed data while trying to save lives. I kept a notebook of all the things I would fix if I could. Little solutions at first, streamlining medication reconciliation, simplifying scheduling. Then bigger ones, integrated patient data systems, predictive, care analytics. I showed my ideas to Blake, the IT director, once. He'd smiled, patted my shoulder, and said, "That's cute, Elsie, but healthcare tech is complicated. Let the big players handle it." I might have left it there if I hadn't met Douglas Warren at a healthcare innovation conference in Chicago. He was charismatic, confident, full of grand visions about disrupting healthcare and patient-centered technology revolutions. I sat in the back row of his presentation, skeptical but intrigued. He had the vision and the business connections, but when the Q&A started, I realized something. He didn't have the practical experience. He didn't really understand how hospitals worked from the inside. When I raised my hand and asked a pointed question about implementation challenges in high-acuity settings, he stumbled. After the session, he sought me out. "That was a good question," he said, extending his hand. "Most people don't think about the practical aspects. Most people haven't spent 4 years watching nurses work around bad software," I replied. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. We talked for 2 hours that day. I showed him my notebook of ideas. His eyes widened as he flipped through the pages. "This is exactly what I've been looking for," he said. "The technical expertise to complement my business vision." 2 weeks later, he called with an offer. Join him as co-founder and chief operations officer of a new healthcare tech startup. He'd handle the business side, the funding, the connections. I'd build the actual product. "We'll change healthcare together," he promised. 50-50, partners. I believed him. The first 2 years were exhilarating. We worked out of a tiny office with mismatched furniture and too many whiteboards. I coded late into the night while Douglas networked during the day. Our first product, a medication reconciliation system that reduced errors by 37% in clinical trials, put us on the map. When we landed our first hospital contract, we celebrated with cheap champagne and expensive dreams. I built a team of developers who believed in our mission. Maggie joined us from a pharmaceutical company, bringing HR expertise we desperately needed. Freddie came on board as our UX designer, transforming complex clinical workflows into intuitive interfaces. Adam joined as our data scientist, helping us turn mountains of health information into actionable insights. We were small but mighty. Family, almost. When Freddie's mother was diagnosed with cancer, we all adjusted schedules so he could take her to treatments. When Adam's wife had twins, we set up a portable crib in the conference room so he could bring them in when childcare fell through. We covered for each other, supported each other. Douglas was less present as time went on. He was always at some conference, some networking event, some investor meeting. But I didn't mind handling the day-to-day operations. I was building something I believed in. Technology that actually helped clinicians do their jobs better, that put patients first. That might actually save lives. Our Series A funding round was a breakthrough moment. $8 million to scale our operations, expand our product line, move into actual offices with matching furniture and reliable air conditioning. Douglas gave a brilliant pitch, all vision and promise and market potential. I provided the technical backbone, the clinical validation, the roadmap for scaling. That night, as we celebrated, Douglas put his arm around my shoulders and said, "We did it, partner. This is just the beginning." I didn't notice then how he emphasized the we when investors were watching, but switched to I when they weren't. I didn't pay attention to how he introduced me as our technical lead rather than co-founder and COO. I was too busy building, improving, expanding. By year 3, HealthCrest had grown to 30 employees and 3 product lines. Our core platform was being used in 17 hospitals across the country. I rarely saw Douglas anymore. He'd moved his office to the top floor, while I stayed with the development team. That made sense to me. I needed to be close to the people doing the actual work. I didn't realize I was being slowly separated from the business side until the day I walked into a meeting with a potential partner hospital and heard Douglas saying, "I developed this system based on my extensive experience with clinical workflows." The chief medical officer nodded, impressed, while I stood in the doorway, the actual developer of the system, suddenly invisible. Later, when I confronted him, Douglas laughed it off. "It's just simpler for pitches, Elsie. People want a clear story. Besides, you hate the spotlight anyway." He wasn't wrong about that last part. I did prefer building to presenting. I felt more comfortable with code than cocktail parties. So I let it go, focusing instead on our newest project, an AI-assisted diagnostic system that was showing promising results in preliminary testing. That project was my baby. I'd conceptualized it after watching an ER doctor miss subtle indicators of sepsis in a patient, the very condition that would later nearly kill me. The algorithm could identify patterns indicating deterioration hours before clinical signs appeared. It could save lives, I was certain of it. I worked 80-hour weeks on that system. I missed dinners with friends, canceled dates, forgot my own birthday. My apartment became a place I visited occasionally to shower and change clothes. The office, with my team, with our mission, that was home. What I didn't realize was that while I was building our future, Douglas was rewriting our past. In media features, in investor decks, in company lore, he was gradually becoming the sole visionary, the technical genius, the healthcare expert. I was being written out of our own story, one press release at a time, and I might never have noticed if I hadn't gotten sick, if I hadn't been forced to step away, if I hadn't been fired via email while fighting for my life. Sometimes you can only see the pattern when you're forced to stop and look up from the work. 2 weeks before I ended up in the hospital, everything seemed to be falling into place. Our AI diagnostic system, the one I'd poured my soul into, had just completed its beta testing at University Medical Center, with results that exceeded even my optimistic projections. The system had flagged early indicators of serious complications. In 94% of cases, an average of 4.7 hours before clinical signs became obvious. In medicine, those hours can mean the difference between life and death. The day the final results came in, I called an all-hands meeting. Our team crowded into the conference room, energy crackling in the air. I presented the findings slide by slide, watching their faces light up as they realized what we'd accomplished together. This isn't just a successful product, I told them. This is why we started HealthCrest. This is technology that will save lives. We celebrated that afternoon, ordered in lunch, popped champagne, took a rare early day off. Douglas wasn't there. He was at a healthcare investment forum in Boston, but I sent him the results with a message. We did it. This changes everything. His response was a single thumbs-up emoji. I tried not to let it bother me. Douglas had always been more reserved about celebrating milestones until they translated to business success. That was his role, keeping us grounded, focused on the market realities while I pushed the technical boundaries. Balance, I told myself. That's why our partnership worked. The following Monday, he called me to his office. I hadn't even seen him since his return from Boston, which wasn't unusual anymore. He was sitting behind his massive glass desk, framed by floor-to-ceiling windows overlooking the city. Sometimes I forgot how much had changed since our days in that tiny first office with the leaky ceiling and the shared desk. Elsie, he said, not looking up from his laptop. We need to talk about the Series C round. Series C, our next major, funding goal. We'd been working toward it for months, planning to raise enough capital to take our AI diagnostic system national, expand our team, and finally move our infrastructure to dedicated servers rather than the cloud setup we'd been using. The results from University Medical look amazing, I said, sliding into the chair across from him. The timing couldn't be better for this raise. He nodded, still focused on his screen. That's what I wanted to discuss. I've been talking with Carrington Capital. They're interested, very interested, but they have some conditions. What kind of conditions? I asked. Something in his tone made me uneasy. They want to see a clear leadership structure, clean lines of authority. He finally looked up at me. They think our current co-leadership model is confusing. I felt my shoulders tense. Confusing? We've been operating this way for 5 years. It works. For a startup, yes, he said smoothly. But we're maturing now, Elsie, looking toward potential acquisition or even IPO in a few years. Institutional investors like Carrington expect traditional corporate structures: CEO, CTO, COO, clear roles, clear reporting lines. And, I prompted, already guessing where this was heading, and they see me as the CEO. You, as CTO, focused purely on the technical side. He leaned forward, his expression earnest. This doesn't change anything about our partnership, Elsie. It's just titles on paper to make the investors comfortable. Just titles, I repeated. So I'd still have co-founder equity? Still have a seat on the board? Still share in major business decisions? He hesitated just a fraction too long. Your equity wouldn't change. The board, well, they're suggesting restructuring there too. More independent directors, fewer insiders. Meaning I'd lose my board seat, I translated. And my role in business, strategy. You'd be able to focus on what you do best, he countered. The technology, the product. Isn't that what you've always wanted? To build without the distraction of investor relations and strategic partnerships? There was a time I might have agreed with him. A time when I would have gladly traded business meetings for more development time. But that was before I understood that without a seat at the table where decisions were made, even the best technology could be compromised, redirected, or worse, attributed to someone else. This feels like a demotion, Douglas, I said carefully. After 5 years as COO, after building this company together, you're asking me to step back and just be the technical person in the background. He sighed, as if I was being difficult. It's not a demotion, it's an evolution. Every company goes through this phase. The roles that made sense at the beginning need to adapt as we grow. And it just happens that your role grows while mine shrinks? I couldn't keep the edge from my voice. This isn't personal, Elsie. It's business. He closed his laptop, giving me his full attention now. Look, the Series C round is crucial. Carrington is offering $40 million. That's enough to take the AI system worldwide, enough to put us on the map in a way we've only dreamed of. Isn't that worth some reorganization? 40 million. It was a staggering amount, enough to realize everything we'd been working toward. And wasn't that the point? To get our technology into as many hospitals as possible? To save as many lives as possible? I need to think about this, I said finally. Douglas's expression softened. Of course, take your time. He paused. But Carrington wants to move quickly. They're hoping to close within the month. I nodded and stood to leave. As I reached the door, he called after me. Oh, and Elsie? The diagnostic system results are phenomenal, really groundbreaking. I'm presenting them at the Healthcare Innovation Summit next week. I'd like you there if you can make it. I should be there regardless, I said. It's my system. Our system, he corrected smoothly. HealthCrest's system. That's how we need to think moving forward, as a unified company, not individual contributions. The irony wasn't lost on me. Suddenly my work was our work, but his leadership couldn't be shared. I spent that night updating my resume. Not because I planned to leave. I didn't, not then. But because I needed to see my accomplishments laid out in black and white. To remind myself of what I had built, what I was worth. 5 years of innovation, of products that worked, of systems that were changing healthcare for the better. The next morning, I woke up with a slight cough. I ignored it, downing cold medicine and heading into the office. We had too much to do, too many decisions to make. A little cold wasn't going to slow me down. 3 days later, I was still mulling over Douglas's proposal when Nina Reynolds from Horizon Ventures called. I'd never heard of her or her firm, but she knew all about me, and more importantly, about my contributions to HealthCrest. I've been following your work for some time, she said, particularly the AI diagnostic system. My sources at University Medical Center say it's revolutionary. We're pretty proud of it, I admitted. You should be. But that's not the only reason. I'm calling. She paused. We're considering a significant investment in HealthCrest, but before we move forward, I'd like to meet with you. Specifically you, Ms. Mitchell. I was confused. You mean with Douglas and me? He handles most investor relations. No, she said firmly. I mean with you. We've done our homework, Ms. Mitchell. We know who built the technology that makes HealthCrest valuable. We know about your clinical background, your technical expertise, and, frankly, The increasing discrepancy between your contributions and your recognition. My heart pounded. It was unsettling to hear from a stranger what I'd barely admitted to myself. I'd like to understand your vision for the company, she continued. Your long-term commitment. Because Horizon doesn't just invest in technology, we invest in the people behind it. We scheduled a meeting for the following week. I didn't tell Douglas about it, partly because I was still processing our conversation about the restructuring, partly because something told me to wait, to listen to what Nina had to say first. But that meeting never happened. The next day, my little cold turned into a fever. The day after that, I could barely get out of bed. By the time my neighbor found me delirious and called an ambulance, the infection had spread to my bloodstream, sepsis. The very condition my AI system was designed to catch early. My first 3 days in the hospital are mostly a blur. Fever dreams, nurses changing IV bags, doctors with concerned expressions. I remember flashes, the cold rush of antibiotics entering my veins, the beeping of monitors, the metallic taste in my mouth from the medications. Sepsis doesn't give you much time for clear thinking. On day 4, I started to surface. The fever broke enough for me to string together coherent thoughts. My first instinct, pathetically, was to check on work. Even lying there with tubes running into my arms, my mind went to the AI project, to the deadlines we were facing, to the people depending on me. My phone wasn't in the room. A nurse, Morgan, according to her badge, told me they'd stored my belongings when I was admitted. You were pretty out of it, she explained, checking my vitals. Kept trying to answer emails in your sleep. That sounded like me. How long have I been here? My voice was a rasp, my throat raw from the breathing tube they'd inserted when my oxygen levels dropped. 4 days, she said. You gave everyone quite a scare. 4 days away from work. The longest I'd been offline since we founded HealthCrest. It felt both terrifying and strangely liberating. Can I get my phone? I asked. I need to let my team know what's happening. Morgan hesitated. The doctor wants you resting, not working. Your body's been through a serious trauma. Just for 5 minutes, I pleaded. They must be worried. She relented, bringing me my phone and charger. 5 minutes, she warned. Then I'm confiscating it again. I had 67 notifications, emails, texts, missed calls. I started with texts from my team. Maggie had sent several. Where are you? Douglas is asking. Are you okay? Nobody's heard from you for 2 days. Elsie, please let me know you're all right. I'm getting worried. Just got word you're in the hospital. What happened? What can we do? I texted her back with shaking fingers. I'm alive, sepsis, getting better. We'll update when I can. There were concerned messages from Freddie and Adam, too. I sent them brief updates promising more information when I was stronger. Then I checked my emails. Most were routine, project updates, meeting invites, customer queries. Nothing that couldn't wait. But 3 caught my attention. The first was from Nina Reynolds at Horizon Ventures. Ms. Mitchell, I didn't hear from you regarding our scheduled meeting. I understand now that you've been hospitalized. Please don't worry about our discussion until you're fully recovered. My offer remains open. Wishing you a speedy recovery. The second was from Douglas, sent the day after I was admitted. Heard. You're in the hospital. Tough timing with the summit next week. Send me your presentation materials for the AI demo. I'll cover it. No, get well soon. No, how are you? Just business. The third email was the one Morgan read to me later that day. The termination notice. After hearing it, I lay in silence, staring at the ceiling. Morgan watched me with concern. Are you okay? Should I call someone? No, I said quietly. I just need to think. And I did think. For the first time in years, I had nothing but time to think. No meetings interrupting me, No crises demanding immediate attention, no code to debug or systems to design. Just me, a hospital bed, and the sudden, stark clarity that comes when someone shows you exactly who they are. Douglas hadn't just fired me. He'd waited until I was at my most vulnerable, literally fighting for my life, to do it. He'd calculated the moment of maximum advantage. And if I was being honest with myself, part of me wasn't even surprised. The signs had been there all along. The gradual rewriting of company history in investor decks. The subtle shifts in how he introduced me at industry events. The way my role in major decisions had been shrinking. The convenient timing of this restructuring proposal, just as our most valuable innovation to date was ready to launch. I'd been so busy building that I hadn't noticed I was being dismantled. The next day, Morgan allowed me my phone for longer periods. I was getting stronger, my mind clearer. I began piecing together what had happened in my absence. An email from Freddie contained a link to a press release dated 2 days after I was hospitalized. HealthCrest founder and CEO Douglas Warren unveils Revolutionary AI Diagnostic System at Healthcare Innovation Summit. The article described how Douglas had conceptualized and developed the system after identifying critical gaps in early sepsis detection. There was a photo of him on stage, pointing to a slide that showed the very algorithms I had written. My name appeared nowhere in the piece. I forwarded it to Maggie with a single question. Did he present this as his work? Her response came quickly. I wasn't there, but Adam was. He said Douglas never mentioned you. I'm so sorry, Elsie. This isn't right. Next, I found a company-wide email Douglas had sent the day before my termination notice. Team, I'm writing to share some difficult news. As you know, Elsie has been hospitalized. While we all wish her a quick recovery, her absence has highlighted significant operational vulnerabilities in our structure. As we approach our Series C funding and potential expansion, we cannot afford these kinds of disruptions. I'll be announcing some organizational changes tomorrow that will strengthen our leadership structure and ensure HealthCrest's continued success, regardless of any individual's availability. He'd been setting the stage, preparing the team for my removal by painting my illness, my brush with death, as an organizational liability, a disruption that needed to be addressed. The betrayal was so complete, so calculated, that it went beyond hurt into something else entirely. Something cold and clear and calm. I spent that afternoon making calls, first to an employment attorney a friend had used during a wrongful termination case, then to a former colleague who'd gone into healthcare journalism, and finally, to Nina Reynolds. Her assistant put me through immediately. Ms. Mitchell, Nina said, her voice warm with concern. I'm so glad to hear from you. How are you feeling? I've been better, I admitted. But I'm recovering. And I just learned I've been fired. A long pause. I see, she said finally. That's unexpected. Is it? I asked. Because from where I'm lying, it seems like Douglas saw an opportunity to consolidate his control just as our most valuable innovation is ready to launch. And just before our potential investment, Nina added. Interesting timing. Did he reach out to Horizon after I was hospitalized? I asked. He did, she confirmed. Wanted to fast-track our discussions. Mentioned reorganizing leadership to streamline decision-making ahead of Series C? Let me guess, with him as the sole decision-maker? Essentially, yes. She paused. Ms. Mitchell, Elsie, this changes our interests significantly. Our due diligence indicated that you are the technical innovator behind HealthCrest's most valuable assets. Douglas is a capable businessman, but we were investing in the partnership. A familiar hollowness settled in my chest. Another opportunity lost to Douglas's maneuvering. I understand, I said quietly. I appreciate your candor. I don't think you do understand, Nina replied. I said this changes our interest, not eliminates it. I'd still like to have that meeting when you're well enough. I'm particularly interested in hearing your thoughts on leadership and innovation in healthcare technology. I frowned, confused. But I'm no longer with HealthCrest. I'm aware, she said. That's what makes our conversation potentially more interesting. After we hung up, I stared at my phone, turning over her words in my mind. What exactly was Nina suggesting? Before I could puzzle it through, a text from Maggie arrived. Douglas, just announced your departure in an all-hands meeting. Said you'd decided your health needed to take priority over work commitments. Claimed it was mutual. People are confused. Adam walked out. Freddie nearly got into a shouting match with him. I'm so sorry, Elsie. This is wrong on every level. So, that was the narrative he'd chosen. Not firing me while critically ill, but a mutual, health-focused separation. Classic Douglas, reshaping reality to suit his purposes. I closed my eyes, suddenly exhausted. But beneath the fatigue, something was hardening. A resolve I hadn't felt in years. I'd given Douglas Warren 5 years of my life, my creativity, my labor. I'd helped build HealthCrest from nothing into a company on the verge of a $40 million funding round. And he thought he could erase me with a single email. He was about to learn how wrong he was. The next few days in the hospital took on a strange dual quality. On one level, I was still a patient, monitored, medicated, healing. The doctors were pleased with my progress. The sepsis was responding to treatment. My organs were functioning properly again. My fever remained low. I was going to survive. But on another level, I was transforming into something else. Something harder, more focused. Each hour I spent in that narrow hospital bed was an hour I spent planning. Morgan, my nurse, became an unexpected ally. She'd been there when the termination email was read aloud, had seen the look on my face. Now she brought me extra Jell-O cups and turned a blind eye when I spent hours on my phone instead of resting. You fighting back? She asked one evening, adjusting my IV. I looked up from an email I was drafting to my attorney. How did you know? She smiled. 20 years in nursing, honey. I know the difference between someone who's given up and someone who's gearing up. She checked my pulse. Good rhythm, strong. Keep that fire burning. I did. The fire was all that kept me from dissolving into the hurt, the betrayal, the sheer injustice of it all. Every time my thoughts started drifting toward self-pity, I redirected them toward action, toward the systematic dismantling of Douglas Warren's carefully constructed narrative. My attorney, Lenny Braverman, visited on my 6th day in the hospital. He was a small man with watchful eyes behind round glasses, carrying a weathered leather briefcase that had seen better decades. So, he said, settling into the visitor's chair beside my bed. You got fired while fighting sepsis. That's a new one. Even for me. I handed him my phone with the termination email displayed. He read it, his expression unchanging except for a slight tightening around his eyes. Classic corporate language, he mused. Technically legal, utterly reprehensible. He looked up at me. What do you want out of this, Ms. Mitchell? I'd been thinking about that question since the moment I'd heard those cold words read aloud. What did I want? Revenge? Money? My job back? I want what's mine, I said finally. Recognition for the work I've done. Protection for the systems I've built. And I want to make sure Douglas Warren never does this to anyone else. Lenny nodded, taking notes in a small leather-bound book. Let's talk intellectual property. As co-founder, what exactly are your ownership stakes in the company's assets? That led to a long, technical discussion about HealthCrest's IP structure. I explained that while the company owned the products, I had been meticulous about documenting my contributions. Source code repositories with commit histories, design documents with my digital signatures, email trails discussing feature development. The AI diagnostic system, in particular, had begun as my personal project before being formally integrated into HealthCrest's portfolio. That's helpful, Lenny said. Many founders aren't so careful. I'm a systems person, I replied. Documentation is second nature. He smiled. Lucky for us. Then his expression turned serious. Now, about the termination itself. The timing is problematic for them. Firing someone during a life-threatening medical emergency could potentially violate several labor laws, not to mention basic human decency. They'll claim it was just unfortunate timing, I said. That the decision was made before I got sick. Let them claim it, Lenny replied, his eyes suddenly sharp. Email metadata will show exactly when that termination notice was drafted. If it was after you were hospitalized, and I'd bet my license it was, they're in troubled waters, he continued, taking notes, occasionally asking clarifying questions. By the time he left, we had the outlines of a strategy. Not just a wrongful termination suit, though that was part of it, but something more comprehensive. A multi-pronged approach that would address the IP issues, the timing of the firing, and the false narrative Douglas was spinning about my voluntary departure. Rest and recover, Lenny advised as he packed up his briefcase. The law moves slowly, and you need your strength. I'll start the preliminary work, but nothing happens until you're out of here and ready. After he left, I felt oddly calm. Not happy, not vindicated. Those feelings were still far off, but purposeful. The path ahead was clear, even if it would be difficult. That evening, my phone buzzed with a text from Adam. Some of us are meeting tomorrow night to talk about what happened. Maggie, Freddie, me, and a few others. We're with you, Elsie. I stared at the message, a lump forming in my throat. I'd been so focused on the betrayal that I hadn't fully processed the loyalty of those who remained. My team, the people I'd hired, trained, and worked alongside, they weren't just employees. They were friends who recognized injustice when they saw it. I typed back, "Thank you. Be careful. Document everything." The next morning, during my daily check-in with my doctor, I finally asked the question I'd been avoiding. "When can I leave, Dr. Patel frowned, reviewing my chart. "Your numbers are improving, but sepsis isn't something you rush recovery from. Another 3 days minimum, I'd say. 3 more days in this room, with its beeping machines and antiseptic smell and endless parade of medical professionals. 3 more days of lying in bed while Douglas consolidated his position and rewrote history. The thought was unbearable. What if I promised to rest at home? I pressed. I have a friend who can stay with me. A lie, but a necessary one. Dr. Patel's expression remained skeptical. Sepsis can relapse if not properly managed. The antibiotics need to be completed under supervision. I understand the risks, I insisted. But I need to address some urgent personal matters. She studied me for a long moment. These urgent matters, are they more important than your life? The question caught me off guard. No, but then they can wait, she said firmly. 3 more days, Ms. Mitchell, that's my medical advice. I nodded reluctantly. What choice did I have? I couldn't fight for my company if I was dead. That afternoon, Nina Reynolds called again. I've been thinking about our conversation, she said after inquiring about my health. I'd like to visit you, if that's permitted. There are some matters, better discussed in person. I was surprised. Venture capitalists don't typically make hospital visits. Are you in town? I flew in yesterday, she replied, for meetings with several healthcare startups in the area. But yours is the situation I'm most interested in. We arranged for her to visit the following day. After we hung up, I found myself wondering again what exactly Nina was proposing. Horizon Ventures had been looking to invest in HealthCrest. Now, that I was no longer part of HealthCrest, what could she possibly want with me? Later that evening, Maggie called from outside the hospital. "We had the meeting," she said, her voice low. "About 20 people showed up, Elsie. Not just the tech team, people from marketing, customer success, even 2 of the clinical advisors. Everyone's upset about how this was handled." "What did Douglas tell them?" I asked. "That's the thing. He's been surprisingly absent since the announcement. Left for a strategic partners retreat this morning. Lenny's running day-to-day operations, but he's clearly uncomfortable. The company-wide Slack channels have gone quiet, but the private ones are blowing up. Lenny, not my attorney, but Lenny Morris, our VP of Business Development. A Douglas hire, loyal to a fault. Of course he'd put Lenny in charge during his absence." "What are people saying?" I asked. Maggie hesitated. "They're confused, angry. There are rumors that you might sue, that the AI system might not launch on schedule without you, that Carrington Capital is reconsidering their investment. Douglas's story about you choosing to leave, for health reasons, fell apart as soon as people started asking questions. Nobody believes it was mutual." I closed my eyes, processing this. "Are you okay? You're putting yourself at risk by organizing these meetings." "Don't worry about me," she said firmly. "Some things are more important than job security. Besides, I've been documenting everything since your first day in the hospital. My instincts told me something wasn't right with how Douglas was handling this." "Smart woman," I said, smiling despite everything. "Learned from the best," she replied. "Get better, Elsie. We're holding down the fort until you figure out your next move." After we hung up, I lay back against the pillows, staring at the ceiling tiles I'd come to know so well. For the first time since reading that termination email, I felt something like hope flickering in my chest. Not just determination or resolve, but actual hope. I wasn't alone in this fight. I had allies, inside Healthcrest and potentially outside, it too, with Nina Reynolds. And most importantly, I had time. 3 more days in this hospital bed meant 3 more days to plan, to gather information, to prepare for whatever came next. Douglas thought he'd won by firing me while I was down. He thought he'd silenced me, erased me, rendered me powerless. He was wrong. Silence wasn't surrender. It was the calm before the storm. Nina Reynolds arrived at exactly 2 p.m. the next day. She wasn't what I expected. In my mind, venture capitalists were middle-aged men in expensive suits with aggressive handshakes. Nina was in her early 50s, with silver-streaked black hair pulled back in a simple ponytail, wearing dark jeans and a cashmere sweater. She carried a small potted orchid rather than flowers, setting it carefully on my bedside table. "Flowers die," she explained. "This might actually outlast your hospital stay." I liked her immediately. She settled into the visitor's chair, crossing her ankles. "How are you feeling?" "Better," I said, which was true physically, if not emotionally. "Thank you for coming." "Thank you for seeing me." She studied me with intelligent eyes. "I imagine you're wondering why a venture capitalist is visiting you in the hospital after you've been fired from the company we were considering investing in?" I smiled weakly. The thought had crossed my mind. Nina nodded, reaching into her messenger bag and pulling out a tablet. "Let me be direct, Ms. Mitchell. Horizon doesn't invest in technologies. We invest in people who create technologies. Our due diligence on Healthcrest made it very clear that you were the driving technical force behind its success." She swiped through several screens on her tablet. "Your background in both software development and clinical healthcare. Your track record of innovations before Healthcrest. The way every product in the company's portfolio reflects your particular approach to human-centered design." She looked up. "We were interested in Healthcrest because of you." "Douglas is a skilled businessman," I said automatically, the diplomatic response still reflexive even after everything. "Douglas Warren is a mediocre businessman with excellent networking skills and questionable ethics," Nina corrected, her tone matter-of-fact rather than judgmental. "Our research suggests he's contributed very little to the actual innovation. At Healthcrest, and has gradually been edging you out of the company narrative for at least the past year. I blinked, startled by her bluntness. I apologize if that's too direct, she said, noticing my reaction. But I believe in being transparent. No, I appreciate it, I said. I'm just not used to people seeing through his facade so clearly. It's my job to see through facades, Nina replied. Now, to the matter at hand. Would you be interested in starting a new venture? I stared at her. What? A new healthcare technology company, she said calmly. With you as founder and CEO. Horizon would provide initial funding of $15 million, with the potential for significantly more depending on development milestones. The offer was so unexpected that for a moment I couldn't process it. But the AI diagnostic system, I said finally. It's HealthCrest's property. The current implementation is, yes, Nina agreed. But the concept, the approach, your expertise in both healthcare workflows and predictive algorithms, those are yours. You can't take the code, but you can certainly build something better. She was right, of course. I'd signed the standard IP agreements when we founded HealthCrest. But my knowledge, my experience, my vision, those couldn't be owned by a company. Besides, Nina continued, our intelligence suggests that without you, HealthCrest will struggle to maintain and evolve the system properly. It's one thing to demonstrate a beta version at a conference. It's quite another to scale it across multiple hospital systems and integrate it with various electronic health records. I thought about the complexity of the system, the hundreds of decision points that weren't documented anywhere but in my head, the inevitable edge cases that would arise during broader implementation. The team could handle some of it, but not all. Why are you offering this? I asked. Why not just wait for HealthCrest to implode without me and pick up the pieces then? Nina smiled, appreciating the directness of my question. 3 reasons. First, the healthcare industry can't afford to wait. Your AI system could save lives immediately. Second, talent like yours doesn't stay on the market long. And third, she paused. I have a personal dislike for people who believe they can discard human beings when they become inconvenient. That last point resonated deeply. I'd been treated as disposable, as if my illness was an inconvenience rather than a life-threatening emergency. As if 5 years of building a company counted for nothing when measured against Douglas's ambitions. I need time to think about this, I said finally. Of course, Nina replied. It's a significant decision. Though I should mention that I'm not the only one who's noticed your sudden availability. Weintraub Medical Systems expressed interest when they heard about your situation, and I believe Axis Health Technologies may reach out soon. My eyebrows rose. How does everyone know about this already? The healthcare tech world is smaller than you might think, Nina said. And a co-founder being fired during a medical emergency makes for compelling industry gossip. She stood, gathering her bag. Take the time you need, Ms. Mitchell. My offer will remain open for 2 weeks. After that, market realities might necessitate adjustments. She placed a business card on my bedside table next to the orchid. Call me when you're ready to talk specifics. After Nina left, I sat in stunned silence, turning her offer over in my mind. A new company, a fresh start. The chance to build something that was wholly mine from the beginning, with proper backing and recognition. It was tempting, incredibly tempting, but also terrifying. Starting over meant rebuilding everything from scratch. It meant competing against my own creation at HealthCrest. It meant more years of 18-hour days and missed weekends. Was I ready for that? Did I have the energy, the drive, the sheer stubbornness required to build another company? My phone rang, interrupting my thoughts. It was Freddie. Elsie, he said, his voice tense. You need to know something. Douglas came back from his retreat today. He's called an emergency meeting with the dev team tomorrow morning about the AI system. What about it? I asked, immediately alert. Wants to accelerate the full launch, Freddie explained. Push it out to all beta partner hospitals within 2 weeks instead of the planned gradual rollout. He's telling everyone it's to capitalize on the momentum from the healthcare summit. But it's to get it deployed before I can do anything legally, I finished. Once it's in active use in hospitals, it becomes much harder to challenge. Exactly. Freddie's voice dropped lower. Adam's freaking out. Says the system isn't ready for full deployment. There are still edge cases we haven't accounted for. Integration issues with 2 of the EHR systems. I closed my eyes, anxiety twisting in my gut. The system was designed to help diagnose life-threatening conditions. Rushing it out prematurely could have serious consequences. What are you going to do? I asked. That's why I'm calling, Freddie replied. We need your guidance. Half the team is ready to push back, but if we're too obvious about it, Douglas might just replace us all. He's already brought in some consultant named Blake to review our work. Blake. The name jolted me. Blake from Memorial West Hospital? IT director, about 50, always wearing bow ties? That's him, Freddie confirmed, surprise in his voice. You know him? We worked together years ago, I said, the pieces clicking into place. He's the one who told me my healthcare tech ideas were cute and should be left to the big players. Well, he's acting like Douglas's best friend now, Freddie said bitterly. Going through all our code, asking questions about implementation details, making notes. A coldness settled over me. This wasn't just about Douglas rushing the product to market. This was about him preparing to move forward without my team, without the people who had actually built the system. Listen carefully, I said, my decision crystallizing as I spoke. In tomorrow's meeting, don't openly oppose the accelerated timeline. Instead, ask very specific technical questions about handling edge cases. Document everything Douglas and Blake say in response. Get them on record making specific claims about the system's readiness. And then? Freddie asked. And then we'll see just how ready Douglas Warren is for what comes next. After hanging up, I reached for Nina's business card, turning it over in my fingers. My mind was suddenly clear, my path forward obvious. I wasn't going to start a new company. Not yet, anyway. First, I had a responsibility to protect the system I'd built, not for my own pride or ownership, but because rushing an unfinished medical diagnostic tool into hospitals could potentially harm patients. And beyond that, I had a responsibility to the team who had built it with me, who were now being sidelined and scrutinized by the very people who had dismissed our vision years ago. I picked up my phone and called Nina. When she answered, I didn't waste time with pleasantries. I have a counterproposal, I said. One that might be more interesting than starting from scratch. I'm listening, she replied. What if, instead of founding a new company, Horizon helped me take back the one I already built? There was a long silence on the phone after my question. I could almost hear Nina weighing the implications, calculating risks and potential returns. That would be unconventional, she said finally. Hostile takeovers aren't typically Horizon's style. I'm not suggesting a hostile takeover, I clarified. At least, not in the traditional sense. What I'm proposing is more strategic. Nina's interest was piqued. Explain. I outlined what I knew. That HealthCrest's board consisted of Douglas, me, though he was likely working to remove me, and 3 outside directors who had primarily interacted with Douglas. That the company was seeking Series C funding to scale the AI diagnostic system. That without me, and potentially without my team, the system's implementation would likely face significant challenges. The board members may not know the full story, I concluded. They may not understand that Douglas fired me while I was critically ill, or that he's now rushing an unfinished medical product to market, potentially putting patients at risk. And you think they would care? Nina asked, not unkindly. 2. of them are former healthcare executives, I said. They understand the risks of premature product launches in medical settings, and all three have fiduciary responsibilities to the company. If they knew Douglas was potentially endangering both patients and the company's future by pushing out an unfinished product and alienating the team that built it, they might reconsider his leadership, Nina finished. It's possible. But what exactly are you proposing Horizon do? Carrington Capital is supposedly offering $40 million for the Series C round, I said. What if Horizon made a competing offer, one contingent on proper governance and leadership? Meaning your reinstatement, Nina said. Not just reinstatement, I replied, the plan forming as I spoke. Proper recognition, a leadership structure that acknowledges who actually built this company and its products. Another pause as Nina considered. You're asking us to enter a bidding war with Carrington, she said finally. That's a substantial request, especially given the current uncertainty around the company's leadership and product readiness. I am, I acknowledged. But you were willing to offer me $15 million to start from scratch. This way, you get a market-ready product with an established customer base and a proven team. And you prevent a potentially disastrous product launch that could set back AI adoption in healthcare diagnostics by years. You make a compelling argument, Nina admitted. Let me discuss this with my partners. In the meantime, what's your next move? I thought about the pieces already in motion. Lenny working on the legal challenges, Freddie and the team gathering evidence about the product's readiness, Maggie documenting the internal response to my firing. I'm getting out of this hospital, I said firmly. Tomorrow. Is that medically advisable? Nina asked. Probably not, I admitted. But it's strategically necessary. I need to meet with people face to face, gather documentation, build support. I can't do that from a hospital bed. Don't underestimate the impact of appearing at key meetings still visibly recovering, Nina suggested. It makes the callousness of your firing all the more apparent. She had a point. The contrast between my physical condition and Douglas's actions would be stark. I'll call you tomorrow with our decision, Nina promised before ending the call. That night I barely slept. Not from pain or illness, but from the storm of thoughts racing through my mind. Possibilities, strategies, contingencies, each one demanding consideration. By morning, I had a clearer picture of what needed to happen, and in what order. First step, get released from the hospital. Dr. Patel was predictably reluctant. Your infection markers are still elevated, Ms. Mitchell. Another 48 hours of IV antibiotics would be the standard protocol. Can I continue antibiotics orally? I asked. I promised to rest, to monitor my temperature, to come back immediately if there are any signs of relapse. She frowned, reviewing my chart again. It's not ideal. Neither is staying here any longer than absolutely necessary, I countered. I have critical personal matters that can't wait. Dr. Patel studied me for a long moment. These personal matters, they're related to your firing, aren't they? I was surprised by her directness. Yes? She nodded slowly. Morgan mentioned it. Normally, I don't involve myself in patients' professional lives, but firing someone during sepsis treatment, she shook her head. That demonstrates a concerning lack of judgment. You have no idea, I murmured. She wrote something on my chart. I'll authorize your release this afternoon with strict conditions. Daily oral antibiotics for 10 more days. Temperature checks every 4 hours. Any fever over 100.4, any increase in pain, any new symptoms, you come back immediately. No exceptions. Agreed, I said instantly. And you need someone to stay with you, she added, at least for the first 48 hours. Is there someone who can do that? I hesitated. There was no one, really. My closest friends were my colleagues, and they were all caught up in the HealthCrest situation. My family lived across the country. Dr. Patel caught my hesitation. Ms. Mitchell, this is non-negotiable. Sepsis can recur suddenly and aggressively. You need monitoring. I'll hire a home health aide, I offered. Someone with medical training who can recognize warning signs. She considered this, then nodded. Acceptable. I'll have the discharge coordinator arrange it. By 4 p.m., I was sitting on the edge of my hospital bed, dressed in the clothes my neighbor had brought days earlier, waiting for the final paperwork. Morgan came in to remove my IV line. Fighting the good fight? She asked, efficiently dealing with the tape and needle. Trying to, I replied. She finished and patted my arm. Some advice from someone who's seen a lot of people at their lowest? Don't let this become about revenge. Make it about justice instead. I looked at her curiously. Is there a difference? Revenge consumes the person seeking it, she said simply. Justice nourishes them. She handed me her personal phone number on a slip of paper. Call if you need anything, medical or otherwise. Just as I was finishing the discharge process, my phone rang. Nina Reynolds. My partners have approved a competing offer, she said without preamble. $45 million, contingent on leadership restructuring and board representation for Horizon. Relief and excitement surged through me. Thank you. Don't thank me yet, Nina cautioned. This is just the first step in what could be a complicated process. When can we meet to discuss strategy? I'm being discharged now, I said. Can you come to my apartment this evening? We arranged for her to come at 7 p.m., giving me time to get home and settled. As I hung up, another call came in. Freddie. The meeting happened, he said, his voice tense. It was revealing. Tell me everything, I said, signing the last of my discharge papers. Douglas and Blake want the system deployed to all partner hospitals within 10 days, Freddie explained. Adam raised concerns about the unresolved edge cases, and Blake dismissed them as perfectionism getting in the way of progress. I could almost hear Blake saying those words, the same dismissive tone he'd used years ago. When Rachel pointed out that 2 of the hospital systems use Epic EHR configurations we haven't fully tested with, Douglas said, and I'm quoting here, "We can patch any integration issues after deployment. The important thing is getting market share before competitors catch up." My blood went cold. In healthcare technology, patch after deployment could mean missed diagnoses, delayed treatments, potentially even lost lives. Did anyone record this? I asked. Better, Freddie replied. It was a video conference. Adam started recording as soon as Douglas mentioned the accelerated timeline, said he needed it for implementation planning. Perfect, I said, feeling a grim satisfaction. Send me the file as soon as you can. As I was wheeled down to the hospital exit, an absurd protocol given that I was perfectly capable of walking, I received another call, this one from a number I didn't recognize. Elsie Mitchell? A man's voice asked when I answered. Speaking. This is Dr. James Harrington, Chief Medical Officer at University Medical Center. We need to talk about the HealthCrest AI system. I felt a jolt of alarm. University Medical was our primary beta testing site. Is there a problem with the system? Not with the system itself, Dr. Harrington clarified. With its imminent deployment. I just received a call from Douglas Warren informing me that the full version will be integrated into our workflow next week. This contradicts the timeline your team provided during our last review. It contradicts the timeline because it's not the agreed-upon schedule, I said carefully. Dr. Harrington, I should inform you that I'm no longer with HealthCrest. I was removed from my position recently. There was a pause. That's concerning, he said finally. Very concerning. You were our primary point of contact throughout development. I understand your concern, I replied. If you don't mind my asking, did Douglas explain why the timeline has been accelerated? He mentioned capitalizing on positive beta results, and something about market positioning, Dr. Harrington said. But frankly, I'm more concerned about patient safety than market position. We agreed to beta test this system because of its potential to improve outcomes, but premature deployment could have the opposite effect. I share your concerns, I said, an idea forming. Would you be willing to document those concerns formally, perhaps in a letter to Healthcrest's board? Another thoughtful pause. I believe that would be appropriate, yes. The board should be aware of the potential clinical implications of rushing this deployment. After providing him with the board member's contact information, I ended the call, mentally adding Dr. Harrington to the growing list of allies. The pattern was becoming clearer with each conversation. Douglas wasn't just eliminating me. He was dismantling everything I'd built, rushed by his own ambition, and perhaps by the fear that I might somehow return to challenge him. And in his haste, he was making mistakes. Critical, documentable mistakes. As I settled into the rideshare, taking me home, I felt a strange calm settling over me. The pieces were aligning, the pattern revealing itself in ways even I hadn't fully anticipated. Douglas's actions weren't just cruel or unethical, they were increasingly reckless. And recklessness, especially in healthcare technology, leaves a trail. A trail I fully intended to follow all the way back to the company I had built. Coming home after nearly 2 weeks in the hospital was surreal. My apartment felt simultaneously familiar and foreign, like returning to a place you've only seen in photographs. Everything was exactly as I'd left it. Coffee mug still in the sink, laptop on the kitchen counter, mail piled up by the door. Frozen in time while I had been transformed. The home health aide, a quiet, efficient woman named Teresa, helped me settle in. She took my vitals, organized my medications, and discreetly placed herself in the guest room, emerging only to check on me periodically. I appreciated her unobtrusive presence. I had 2 hours before Nina was scheduled to arrive. 2 hours to gather my thoughts and prepare for what might be the most important meeting of my career. I showered carefully, mindful of my still healing body, and changed into clothes that struck a deliberate balance. Professional enough to be taken seriously, casual enough to remind everyone that I was recovering from a life-threatening illness. My phone had been buzzing consistently since I left the hospital. Maggie sending updates about internal company dynamics. Freddie forwarding the promised recording of the meeting. Lenny Braverman with legal questions. And a surprising message from Dr. Patel, wishing me luck and offering her professional testimony if needed regarding the timing and circumstances of my termination. I was organizing all these communications when my doorbell rang. Nina Reynolds, 10 minutes early. I hope you don't mind, she said when I opened the door. I figured you might appreciate getting started sooner rather than later. She wasn't alone. Behind her stood a tall man with silver-gray hair and wire-rimmed glasses. This is Robert Calloway, Horizon's senior counsel, she explained. I thought having legal perspective from the outset might be valuable. I invited them in, noticing how Robert's eyes quickly assessed my apartment, the bookshelves overflowing with medical and technical texts, the whiteboard covered in system architecture diagrams, the modest furnishings of someone who spent more time working than decorating. You live your work, he observed mildly as we settled in the living room. Is that a problem? I asked. Quite the opposite, he replied. It's consistent with everything we've learned about you. Nina pulled out her tablet and a small recorder. Do you mind if we record this conversation? For our internal documentation only. I nodded my agreement, and she placed the device on the coffee table between us. Before we discuss specifics, Nina began, I want to be clear about Horizon's position. We're prepared to offer $45 million for a Series C investment in Healthcrest, contingent on leadership changes and board representation. But we need to understand exactly what we're walking into. And what legal minefields might be waiting, Robert added. I appreciated their directness. Fair enough. What do you want to know first? Let's start with the board, Nina suggested. You mentioned there are 3 outside directors besides you and Douglas. What do we know about them? I outlined what I knew about each board member. Dr. Elaine Winters, former CMO of a major hospital system, had joined our board early on because she believed in the clinical value of our work. Mark Daniels came from a venture capital background and had been Douglas's choice. The third, Richard Tao, was a technology executive who'd invested personally in our seed round. Elaine has always been supportive of my work, I explained. She understands the clinical side deeply. Mark tends to follow Douglas's lead on most issues. Richard is more independent. He asks hard questions and genuinely wants the company to succeed. And your current standing on the board? Robert asked. Has your termination as COO affected your board position? Not officially, I said. Douglas would need board approval to remove me, and there's been no vote. But he's likely working on it. Nina nodded thoughtfully. So potentially 2 votes with you, 2 with Douglas, depending on how Richard Tao breaks. Exactly. And Richard's priority has always been company value. If he believes Horizon's offer is better for the company than Carrington's, especially given the current circumstances, he might be persuadable. Robert made some notes. Now, regarding your termination, you have clear documentation that this occurred while you were hospitalized for sepsis? I pulled up the email on my phone and handed it to him. He read it carefully, his expression remaining neutral except for a slight tightening around his eyes. Timestamp shows this was sent at 10:14 a.m. on the 7th day of your hospitalization, he noted. Was there any prior discussion of termination? Any performance concerns documented before your illness? None, I said firmly. In fact, just the opposite. The AI diagnostic system that's now our flagship product was my initiative, my design. The beta testing results had exceeded projections. If anything, my position should have been stronger than ever. And yet he chose that moment to fire you, Nina observed. The timing suggests opportunism. He saw a chance to consolidate control while you were incapacitated. I hadn't thought of it quite that way, but she was right. Douglas hadn't just been cruel. He'd been calculating, waiting until I was literally fighting for my life to make his move. There's more, I said, pulling out my laptop. Freddie, our lead UX designer, sent me a recording of a meeting today. It shows Douglas and his new consultant, Blake, pushing to rush the AI system to full deployment despite clear technical warnings from the team. I played portions of the video, watching Nina and Robert's reactions as they heard Douglas dismissing legitimate safety concerns in favor of market positioning. Nina's expression grew increasingly troubled, while Robert took rapid notes. This is potentially significant from a liability standpoint, Robert said when the recording ended. If they deploy a medical diagnostic system prematurely and patients are harmed? Exactly, I said. And Dr. Harrington from University Medical Center has already expressed concerns. He's drafting a letter to the board about the rushed timeline. Nina leaned forward. This gives us multiple angles. The wrongful termination is compelling on its own. Firing a critically ill co-founder shows remarkably poor judgment. But rushing an unfinished medical diagnostic tool to market potentially creates both legal and financial risks for the company. And for the board members personally, Robert added. Their fiduciary duty includes ensuring the company isn't taking unnecessary risks. If they know about these concerns and proceed anyway. I hadn't considered the personal liability angle for board members. So what's our next step? Nina and Robert exchanged glances. We need to move quickly, she said. Douglas clearly is. I propose a 2-track approach. First, we need to communicate directly with the board, not just about the Horizon offer, but about these serious concerns regarding Douglas's leadership and the AI system deployment. Second, Robert continued, we should prepare formal documentation of your wrongful termination claim, not necessarily to file immediately, but to have ready as leverage. What about the team? I asked. Maggie, Freddie, Adam. They're all providing information, but they're putting their jobs at risk. Whistleblower protections would apply in the case of rushed medical software deployment, Robert noted. But yes, there's risk. Would they be willing to make formal statements? I thought about it. If they believed it would prevent a premature launch that could harm patients? Yes, I think they would. Nina nodded, making notes on her tablet. Good. Now, let's talk timing. Douglas is pushing for deployment within 10 days, and likely trying to finalize the Carrington deal on a similar timeline. We need to move faster. I want to meet with Richard Tao first, I decided. One-on-one before any formal board communication. If I can get him to understand what's happening, he might be our swing vote. Can you get that meeting quickly? Nina asked. I think so. We've always had a good relationship and he respects technical expertise. I pulled out my phone and sent a brief message to Richard, requesting an urgent meeting regarding HealthCrest's future. Once I've spoken with him, we can approach the full board with the Horizon offer and our concerns. Perfect, Nina said. While you're doing that, Robert and I will prepare the formal documentation and structure the offer details. As they prepared to leave, Nina paused at the door. One last question, Elsie. If this works, if we successfully intervene and the board supports leadership changes, what exactly are you hoping for? It was the question I'd been asking myself since that termination email arrived. What did I really want? I want to be CEO, I said, the words feeling right as I spoke them. Not just reinstated as COO. Douglas has shown he can't be trusted to lead this company responsibly. The team deserves better leadership, and the patients who will ultimately rely on our technology deserve better stewardship. Nina smiled, a small, satisfied expression. That's exactly what I was hoping you'd say. After they left, I sat alone in my living room, the weight of what we were attempting settling over me. This wasn't just about getting my job back or even about justice for being fired while critically ill. This was about taking full responsibility for the company I'd helped build, the technology I'd created, and the people who had trusted me with their careers and talents. Teresa appeared quietly from the guest room to check my temperature and blood pressure. You look tired, she observed. You should rest. She was right. The day had drained what little energy my recovering body had. But as I lay in bed that night, my mind was already racing ahead, mapping out strategies, anticipating obstacles, preparing for what would undoubtedly be the fight of my professional life. My phone buzzed with a response from Richard Tao. Ken, meet tomorrow 10 a.m., my office. Concerned about recent developments. The first piece was moving into place. The next morning, I woke feeling stronger than I had in days. Whether from being in my own bed or from having a clear purpose, I couldn't say. Teresa checked my vitals, nodding with cautious approval. Temperatures. Normal, she said. But you're still recovering. Don't overdo it today. I promised to be careful, though we both knew I'd push my limits. Some battles can't wait for full recovery. Richard Tao's office was in a sleek building downtown. I deliberated over transportation options and decided on a rideshare rather than driving myself, partly due to lingering fatigue, partly because arriving in a car service rather than my own vehicle would subtly reinforce that I was still recovering. The ride gave me time to organize my thoughts. Richard was analytical, evidence-driven, and deeply concerned with risk management. If I approached this purely as a personal grievance, I'd lose him. But if I could frame it as a business and ethical risk to HealthCrest, he'd listen. His assistant met me in the lobby, her eyes widening slightly at my appearance. I knew I looked different, thinner, paler, with the unmistakable fatigue of serious illness still visible in my face. Good. Let that be a visual reminder of what I'd been through. Mr. Tao is expecting you, she said, leading me to the elevator. Richard's office was minimalist, glass, steel, and white surfaces, with a spectacular view of the city. He rose when I entered, his normally impassive face showing a flicker of concern. Elsie, he said, coming around his desk to greet me. I'm glad to see you up and about. Your message sounded urgent. It is, I replied. Thank you for seeing me so quickly. We sat in a small seating area by the window rather than across his desk, a good sign. It suggested conversation rather than confrontation. I understand congratulations are in order for the AI diagnostic system, he began. The beta results look impressive. They are, I agreed. The system is identifying potential sepsis cases nearly 5 hours before clinical symptoms become obvious. In medical terms, that's revolutionary. And yet, Richard said carefully, I sense there are complications beyond the technical. This was why I'd always appreciated Richard. He cut through pretense, getting straight to the heart of matters. Yes, I said. Significant ones. I assume Douglas has informed the board of my departure from the company? Richard's expression turned cautious. He notified us that you had chosen to step down due to health concerns. Given your recent hospitalization, it seemed plausible, if unfortunate timing. I pulled out my phone, opened the termination email, and handed it to him. This is what actually happened. Sent while I was in intensive care, fighting sepsis. Ironically, the very condition our AI system is designed to catch early. Richard read the email, his face remaining neutral, but I noticed the slight tightening of his jaw. The same tell he had when reviewing troubling financial projections. This is concerning, he said finally, handing back the phone. Both in substance and timing. The timing wasn't accidental, I said. Douglas has been systematically working to minimize my role for months, ever since the AI system started showing promising results. My illness was simply a convenient opportunity to complete the process. Richard leaned back, considering. That's a serious allegation. I wouldn't make it without evidence, I replied, pulling out my tablet. I have documentation of Douglas, progressively claiming credit for my technical innovations, removing me from key meetings, and repositioning himself as the visionary behind products he barely understood. I showed him slides from recent investor decks, press releases where my contributions had been systematically diminished or eliminated, and meeting invites that had inexplicably excluded me from discussions about my own projects. This could be interpreted as normal corporate evolution, Richard said, though his tone suggested he wasn't convinced of that himself. Companies often centralize their messaging around a single figurehead. Perhaps, I conceded. But there's more, and it directly affects company risk and patient safety. I opened the video Freddie had sent me, playing the key segment where Douglas and Blake dismissed serious technical concerns about rushing the AI system to full deployment. Richard watched intently, his frown deepening as Douglas said, "We can patch any integration issues after deployment." How serious are these unresolved issues? Richard asked when the video ended. Serious enough that Dr. Harrington at University Medical Center is drafting a formal letter of concern to the board, I replied. The system is revolutionary when properly implemented, but rushing it could potentially lead to misdiagnoses or false positives, both dangerous in critical care settings. Richard was silent for a moment, processing. Why would Douglas push for premature deployment? The risks seem unnecessary. This was the key question. 2 reasons, I explained. First, he's trying to secure the Series C funding from Carrington. Capital before any legal challenges I might mount regarding my termination. Second, he's bringing in outside consultants like Blake who don't understand the system's complexity but are willing to support his timeline. And you think these consultants are meant to replace your team eventually? I know they are, I said. Blake has been systematically documenting our codebase and questioning team members about implementation details. He's not evaluating the system. He's preparing to take it over. Richard nodded slowly. So Douglas fires you while critically ill, rushes an unfinished medical diagnostic system to market despite safety concerns, and potentially plans to replace the team that built it, all while pursuing a major funding round. Precisely. What are you asking for, Elsie? He asked directly. Reinstatement? No, I said firmly. The situation has moved beyond that. What I'm asking for is a special board meeting to address these concerns. and I'm bringing a competing offer for the Series C round from Horizon Ventures for $45 million, $5 million more than Carrington's offer. Richard's eyebrows rose. Horizon? They're not typically in the healthcare space. They're expanding their portfolio, I explained. But their offer comes with conditions, including leadership changes and board representation. Meaning Douglas would no longer be CEO, Richard translated. I nodded. His recent actions demonstrate poor judgment and potentially expose the company to significant liability. The board has a fiduciary duty to consider these facts. Richard was quiet for a long moment, gazing out at the city skyline. You know, he said finally, when Douglas called the emergency board meeting about your resignation, something felt off. He was too prepared, too smooth with his rationale. Like he'd rehearsed it. He had, I said. He'd been planning it. What's your ideal outcome here, Elsie? Assuming the board agrees with your assessment? I met his gaze steadily. I want to be CEO, not out of revenge or ambition, but because this company, this technology, is too important to leave in hands that value market positioning over patient safety. Richard nodded, appearing to have reached a decision. I'll call for a special board meeting. Tomorrow, if possible. The deployment timeline alone justifies urgency. Relief washed through me. Thank you. Don't thank me yet, he cautioned. I'm only committing to a full and fair hearing. Douglas will have his opportunity to respond as well. That's all I'm asking for, I said. A chance for the board to make an informed decision with all the facts. As I gathered my things to leave, Richard asked, Does Douglas know you're meeting with me today? I don't believe so, I replied. Why? Because if he's as calculating as you suggest, he'll move quickly once he realizes you're taking action. Be prepared. It was a warning I took seriously. As I left his office, I texted Maggie. Meeting went well. Be extra careful with communications. Today, Dee may realize something's happening. Her response came quickly. Already on it. FYI, Blake requesting full system architecture docs and admin access to code repositories. Exactly as Richard had predicted, Douglas was accelerating his plans. In the lobby, I was checking my phone for a rideshare when a familiar voice called, my name. I turned to see Blake, my old colleague from Memorial West, now Douglas's consultant, walking toward me, surprise evident on his face. Elsie Mitchell, he said, his smile not reaching his eyes. What a coincidence. I heard you were unwell. I'm recovering, I replied neutrally. What brings you to this building? Meeting with potential partners, he said vaguely. And you? It was no coincidence. He was either meeting with Richard himself or checking on me. Either way, Douglas would know about my visit within minutes. Just catching up with an old friend, I said, matching his vagueness. Good to see you, Blake. As I walked away, I could feel his eyes on my back. The clock was ticking faster now. Whatever move Douglas would make in response to my meeting with Richard, it would come soon. My phone buzzed with a text from Nina. Documentation ready. Horizon offer formalized. How did the meeting go? Board meeting likely tomorrow, I replied. Be ready. Opposition aware and moving. The game was fully in motion now, pieces shifting rapidly across the board. Douglas had made his moves in the shadows, while I was too ill to defend myself. Now I was making mine in the light, with allies and evidence at my side. Tomorrow would determine which approach prevailed. I barely made it back to my apartment before the adrenaline that had carried me through the meeting with Richard began to fade. My body, still recovering from sepsis, reminded me forcefully of its limitations. Teresa took one look at me as I came through the door and ordered me to lie down while she checked my vitals. Blood pressure's elevated, she said with professional disapproval. Temperature's starting to climb too. You've pushed too hard. I didn't argue. I knew she was right. She gave me my antibiotics and a mild pain reliever, then insisted I rest for at least 2 hours. "Whatever battle you're fighting," she said firmly, "you won't win it if you end up back in the hospital." As I lay in bed, my phone buzzed with a message from Freddie. "Blake just locked down the main code repository. Only he and Douglas have admin access now. Team is freaking out." The move was even more aggressive than I'd anticipated. Douglas wasn't just preparing to replace the team. He was actively cutting them off from their own work. It was a clear signal that he knew something was happening and was moving to secure his position. Before I could respond, another message arrived. This one from Adam. "Just overheard Dee on phone with someone. Said, she's moving faster than expected. We need to accelerate everything." Then something about board votes and getting the agreement signed. Douglas was trying to lock in the Carrington deal before the board meeting. If he could get binding, preliminary agreements in place, it would be much harder for the board to pivot to Horizon's offer, regardless of what they thought about his leadership. I forwarded both messages to Nina with a quick note. "Douglas accelerating. May try to lock in Carrington deal before board meeting. Need to be ready for tomorrow." Her response was immediate. "On it. Robert already drafting cease and desist regarding rushed AI deployment. We'll have it ready by morning if needed." I closed my eyes, suddenly overwhelmed by both physical exhaustion and the enormity of what we were attempting. For 5 years, I'd been the technical mind behind HealthCrest, content to build in the background while Douglas handled the business side. Now I was orchestrating a complex maneuver to take control of the company I'd co-founded, potentially, forcing out the person I'd once trusted as a partner. Had I changed that much? Or had I simply been forced to see what was always there, beneath the surface of our partnership? My phone rang, interrupting these thoughts. It was Maggie. "Are you somewhere private?" she asked without preamble. "Yes," I said, immediately alert. "What's happening?" "Douglas just called an all-staff meeting for 4 p.m., she said, her voice tense. "The calendar invite says, important company update and strategic shift. No other details." That was less than 2 hours away. "He's going to announce something major," I said. "Probably about the AI system deployment. Maybe about the Carrington deal." "That's what we figured," Maggie agreed. "But there's more. He's bringing in security personnel. 2 uniformed guards arrived about 30 minutes ago and have been meeting with him and Blake. Adam thinks they're preparing to escort people out." Heart sank. "The team looks that way," she confirmed. "We're trying to back up as much as we can, but with the repository locked down. Don't do anything that could be construed as intellectual property theft," I warned. "That would play right into their hands." "We're being careful," she assured me. "But Elsie, if he's planning to let people go, that means he thinks he can finish the deployment without us. Which means he probably already has a replacement team lined up," I finished. "Likely through Blake." This was moving even faster than I'd feared. Douglas wasn't just defending. He was launching a preemptive strike, removing potential obstacles before I could fully mobilize. "What should we do?" Maggie asked. It was a crucial question. If Douglas was about to dismiss the core technical team, the people who understood the AI system intimately and had been raising safety concerns, the risks to both the company and potential patients would increase dramatically. Attend the meeting, I decided. Document everything he says. If he announces anything about accelerated deployment, ask specific technical questions about the unresolved issues. Get his responses on record. If he talks about staff changes, don't argue or walk out. Just make sure you understand exactly what's happening and why. "And after?" she pressed. "After, we adapt," I said. "But whatever happens, remember that tomorrow's board meeting is still our best chance to change course." As soon as we hung up, I called Nina. She answered immediately. "Douglas is making a move," I explained, outlining what Maggie had told me. "He's likely going to announce an accelerated deployment schedule and possibly dismiss core team members who've raised safety concerns." Nina was silent for a moment, processing. This changes our timeline. If he's removing the technical team today, we can't wait until tomorrow's board meeting to take action. What are you suggesting? I asked. A temporary restraining order, she replied. Robert can file it this afternoon if we can demonstrate immediate potential harm. It wouldn't stop the staff changes, but it could halt the AI deployment until the board has reviewed the concerns. It was an aggressive move, one that would burn any remaining bridges with Douglas, but the situation called for it. Do it, I said. Use Dr. Harrington's concerns and the team's documented objections as the basis. We'll need your formal statement as well, Nina said. As the system's architect, your testimony about the potential risks of premature deployment would be crucial. I agreed to send it within the hour. As I hung up, a wave of clarity washed over me. For days, I'd been approaching this as a complex chess match, anticipating moves, positioning pieces, thinking several steps ahead. That approach had served me well initially, but now it was time for something more direct. It was time to stop reacting to Douglas's moves and start making my own. I sat up, ignoring the lingering weakness in my body, and began typing a message to the entire Healthcrest board. Dear board members, I'm writing to inform you of serious concerns regarding both my termination as COO while hospitalized with sepsis and the current rushed deployment of our AI diagnostic system despite documented safety concerns. These issues will be addressed formally at tomorrow's special board meeting. However, I've just learned that Douglas Warren intends to dismiss key technical team members today who have raised valid safety objections to the accelerated deployment timeline. The AI system in question is designed to identify early indicators of life-threatening conditions. Rushing it to market with known unresolved issues creates potential risks to patients and significant liability for Healthcrest. I am therefore informing you that Horizon Ventures' legal team is filing for a temporary restraining order to halt deployment until the board has reviewed all evidence. I wanted you to hear this from me directly, as it reflects the seriousness of the situation rather than any desire for adversarial proceedings. I remain committed to Healthcrest's mission and technology. Tomorrow's meeting will include a competing Series C funding offer from Horizon Ventures, 45 million versus Carrington's 40 million, contingent on leadership changes that I believe are necessary for the company's future success and ethical operation. Respectfully, Elsie Mitchell, co-founder and board member. I read it over twice, taking a deep breath before hitting send. This wasn't just a tactical move, it was a declaration. I was no longer the background technical partner who avoided confrontation and focused solely on the product. I was stepping fully into leadership, challenging unethical behavior, and taking responsibility for both the company's future and the safety of the patients our technology would serve. It felt like crossing a threshold I hadn't even realized was there. A shift from seeing myself as a technical expert who happened to co-found a company to recognizing myself as a leader whose technical expertise was only one facet of what I brought to the table. My phone immediately lit up with responses. Richard Tao. Message received. Concerning developments. We'll call other board members to discuss. Dr. Elaine Winters. Extremely troubling. Available for emergency call today if needed. Even Mark Daniels, Douglas's ally on the board. Serious allegations requiring immediate review. No response from Douglas himself. He'd either not seen the message yet or was too busy executing his plans to respond. As I finished drafting my statement for the restraining order application, Teresa came to check on me again. Your color's better, she observed. But you're still doing too much. I smiled faintly. Sometimes the healthiest choice isn't the most restful one. She shook her head but didn't argue. Instead, she asked, Is this worth it? Whatever you're fighting for? Is it worth risking your recovery? I thought about the AI system, about the lives it could save when properly deployed, about the team that had built it with me, who were now facing dismissal for raising valid safety Concerns about what it would mean if someone like Douglas, who valued market position over patient safety, remained in control of technology with such potential for both harm and healing. Yes, I said simply, it's worth it. As 4 p.m. approached, the time of Douglas's all-staff meeting, I found myself surprisingly calm. Whatever happened in that meeting, whatever moves Douglas made next, I was no longer reacting from a place of hurt or betrayal. I was acting from conviction, from clarity about who I was and what I stood for. The transformation wasn't just in how others would see me after today. It was in how I saw myself. At 4:12 p.m., my phone lit up with a series of rapid-fire texts from Maggie. It's happening. Dee just announced organizational restructuring to support accelerated market strategy. Adam, Freddie, me, and half the technical team being let go. Effective immediately. Security collecting our badges. Dee claiming philosophical differences in approach to deployment. Says new team already identified to carry us forward. Presenting this as necessary for Series C funding. Mentioned Carrington by name. Said, finalization imminent. Being escorted out now. Will call when able. I stared at the messages, a cold anger settling in my chest. Douglas wasn't just removing the team, he was publicly framing them as obstacles. To progress, as philosophical dissenters rather than professionals raising legitimate safety concerns. Before I could respond, my phone rang. It was Nina. Robert's filing the TRO right now, she said without preamble. We've included your statement along with Dr. Harrington's letter and the video evidence. The judge should rule by morning. It might be too late, I said, forwarding her Maggie's texts. Douglas is dismissing the core technical team as we speak, and he's telling everyone the Carrington deal is nearly finalized. Nina was silent for a moment. This changes things. We need to move the board meeting up to tonight if possible. Is Richard Tao reachable? I'll call him now, I promised. Richard answered on the second ring. I was about to call you, he said, sounding troubled. I just received a message from Douglas about an emergency board call at 7 p.m. to ratify urgent business decisions. He's trying to get board approval after the fact, I realized. He's already dismissed half the technical team, including Maggie, Adam, and Freddie, the people who raised safety concerns about the AI deployment. That's extremely concerning, Richard said, his tone hardening. Making personnel decisions of that magnitude without board consultation, especially when they impact a critical product launch. We need to use this 7 p.m. call to address everything, I urged. Not just the firings, but my termination, the safety concerns with the AI system, and the competing investment offer from Horizon. Agreed, Richard said. I've already spoken with Elaine. She shares our concerns about the rushed deployment. Mark is more difficult to read, but he seemed genuinely troubled by the timing of your termination. Will Douglas be able to exclude me from the call? I asked, suddenly worried. No, Richard said firmly. You're still a board member. He cannot legally prevent your participation. The call will be through the secure board portal, and I'll personally ensure you receive the access details. As soon as we hung up, I called Lenny Braverman to update him on the accelerating situation. They're going scorched earth, he observed. Firing an entire technical team is a dramatic move, especially before securing board approval. Is there anything we can do for the team legally? I asked. Potentially, he said. If they were terminated for raising legitimate safety concerns about a medical product, there could be whistleblower protection implications. Have them document everything, exactly what they said in meetings, any emails they sent expressing concerns, and the precise reasons given for their termination. I texted this guidance to Maggie, who responded that they were gathering at a coffee shop near the office and would call me soon. Next, I reached out to Nina again. Board call at 7 p.m. We need everything ready, the Horizon offer, the legal assessment, all of it. We'll be prepared, she assured me. But Elsie, You should consider attending this meeting in person rather than virtually. Your physical presence, still, visibly recovering from the illness during which you were fired, would be powerful. She had a point. The contrast between my obvious recent illness and Douglas's callous actions would be stark and impossible to ignore. I'll be there, I said, making the decision instantly. Can you send a car? Already arranging it, Nina replied. Robert and I will pick you up at 6:30. Teresa objected strongly when I told her I was attending an in-person meeting. Your body needs rest to recover, she insisted, checking my temperature again. Not corporate warfare. Sometimes healing has to wait, I said, rising carefully to get dressed. Some infections, like sepsis, like toxic leadership, need to be addressed immediately before they cause more damage. She didn't approve, but she helped me select clothing that was both professional and comfortable, and made sure I took my antibiotics before leaving. While waiting for Nina's car, I received a call from Maggie. I put her on speaker so I could continue getting ready. We're all together, she said, background noise suggesting a crowded cafe. Freddie, Adam, Rachel, most of the technical team. Douglas gave everyone the same story. Our approach to deployment wasn't aligned with the company's accelerated timeline. Who's left? I asked. Mostly junior people, she said. And a team of 5 new developers Blake brought in. They were waiting in the conference room during the announcements. It was all planned. Of course it was, I said grimly. Did Douglas say anything specific about the AI system launch? Yes, Maggie confirmed. He announced full deployment to all partner hospitals will begin tomorrow morning. Said the board would be formalizing the decision tonight. My blood ran cold. Tomorrow? That's even faster than we thought. Elsie, the system isn't ready. Freddie's voice cut in, sounding frustrated. The Epic integration issues alone could cause significant problems in 3 of the 7 partner hospitals. I know, I said. We're filing for a temporary restraining order to halt the deployment, and there's a board meeting tonight where I'll be present. This isn't over. What should we do? Adam asked. Document everything, I instructed. Every concern you raised, every response Douglas or Blake gave dismissing those concerns, and be ready to speak to these issues if needed, whether to the board tonight or to regulators if it comes to that. Nina's car arrived just as I was finishing the call. Through the window, I could see her and Robert waiting in the back seat of a sleek black sedan. As Teresa helped me with my coat, she pressed a small pill case into my hand. Your evening antibiotics, she said. Don't forget them, and call me if you need to be picked up early. I thanked her, touched by her concern despite her disapproval of my mission. Then I walked carefully to the waiting car, each step purposeful. It was time to reclaim what was mine. The Healthcrest boardroom was on the top floor of our building, a sleek space with glass walls overlooking the city. As Nina, Robert, and I stepped out of the elevator, I steeled myself for what was coming. I hadn't been in this space since before my hospitalization, and now I was returning not as COO, but as someone fighting for the company's future. Through the glass, I could see Douglas already inside with Blake beside him. They were standing at the head of the table, reviewing documents, completely at ease, as if the day's mass firings were routine business decisions rather than desperate power moves. Mark Daniels sat to Douglas's right, checking his phone. Doctor, Elaine Winters was seated opposite, her expression carefully neutral. Richard had texted that he was running a few minutes late. Douglas looked up as the door opened, his practiced smile freezing when he saw me. I watched the progression of emotions cross his face. Shock, quickly masked by forced composure, followed by a calculating assessment of the situation. Blake showed less control, his eyes widening in undisguised alarm. Elsie. Douglas recovered, smoothly. This is unexpected. I understood you were still recovering. I am, I said, my voice steady despite the accelerated pounding of my heart. But some matters can't wait for full recovery, like discovering the technical team has been dismissed without board approval or that an unfinished medical diagnostic system is being rushed to deployment tomorrow. Dr. Winters looked sharply at Douglas. Tomorrow? The deployment timeline we approved was phased over 6 weeks. Market conditions have evolved, Douglas replied, his tone professionally regretful. As I was about to explain, we've had to accelerate certain aspects of our strategy to maintain competitive advantage. By firing the entire team that built the system? I asked, taking my seat at the table. By pushing a deployment that your own team warned could put patients at risk? Mark Daniels frowned. What risk? The board hasn't been advised of any safety concerns. I opened my laptop. Allow me to fill in those gaps then. The boardroom door opened again as Richard entered, nodding to me with subtle encouragement. Douglas quickly tried to regain control of the meeting. Before we get sidetracked, let's address the actual agenda. We've made significant operational changes today to position Healthcrest for the Carrington investment. We need board ratification for decisions you've already implemented without board approval, Richard interrupted, taking his seat. That's not how governance works, Douglas. Extraordinary circumstances required immediate action, Douglas insisted. The technical team was deliberately obstructing our deployment timeline, jeopardizing our Series C funding. Or perhaps, Dr. Winters suggested, they were raising legitimate concerns about a medical product that, if deployed prematurely, could harm patients. The directness of her question created a moment of tense silence. Douglas glanced at Blake, who stepped forward with a confidence that didn't quite reach his eyes. As I've assessed, the system is fully deployment ready, Blake stated. The previous team's concerns were excessive caution bordering on perfectionism, admirable in theory, but impractical for market realities. And your assessment is based on what clinical expertise exactly? I asked quietly. Blake faltered slightly. I've reviewed all the test data and… You were an IT administrator at Memorial West Hospital, I continued. You have no background in clinical diagnostics, machine learning, or sepsis detection. Yet you're overriding the concerns of the team that built this system from the ground up? Dr. Winters leaned forward, suddenly alert. Is that accurate, Mr. Gardner? Blake supplied. Blake Gardner. And I have extensive healthcare IT experience, but not in clinical algorithm development, Dr. Winters pressed. Not in predictive diagnostics for life-threatening conditions, Douglas intervened. We're getting bogged down in technical details. The point is, the system has passed all its beta tests with flying colors. Further delays are unnecessary and commercially disadvantageous. That's not actually for you to determine unilaterally, Nina said, speaking for the first time. Especially when a competing offer is on the table that would value both patient safety and proper corporate governance. Douglas's eyes narrowed. And you are? Nina Reynolds, Horizon Ventures, she replied calmly. We're prepared to offer $45 million in Series C funding, contingent on leadership changes that would prioritize both innovation and patient safety. The room fell silent again, the power dynamic shifting palpably as the stakes became clear to everyone. Douglas's composed facade cracked slightly. This is highly irregular, he said, glancing between board members. Outside parties have no place in a confidential board meeting. Ms. Reynolds is here at my invitation, I explained. As a board member, I'm entitled to bring advisors when discussing potential investment opportunities. Mark Daniels leaned forward. $45 million is certainly compelling, but Carrington's offer is already in advanced stages. We can't simply… We not only can, we must, Richard interrupted. Our fiduciary duty requires considering all viable offers, especially one that exceeds our current option by $5 million. Douglas's jaw tightened. Carrington's offer isn't just about the money. It's about strategic alignment, about acceleration, about About getting the deal done before anyone could question your leadership decisions, I suggested. Like firing me while I was hospitalized with sepsis? Or dismissing the entire technical team when they raised safety concerns? Dr. Winters turned to Douglas, her expression grave. I'd like to see the safety concerns that were raised, specifically. Before Douglas could deflect, I connected my laptop to the room's display system and pulled up the video Freddie had recorded. The room watched in tense silence as Douglas and Blake dismissed critical integration issues, with Douglas clearly stating they would patch any problems after deployment. When it ended, Dr. Winters removed her glasses slowly. In my 40 years of medical practice and healthcare administration, I have never witnessed such a reckless approach to deploying medical technology. Douglas flushed. The concerns are theoretical. Every system has minor bugs at launch. Minor bugs? I echoed. We're talking about a system that influences clinical decisions about life-threatening conditions. There's nothing minor about integration failures in that context. Robert Calloway, who had been quietly observing, spoke up. The board should be aware that we've filed for a temporary restraining order to halt tomorrow's deployment pending proper review of these safety concerns. The court will likely rule by morning. You did what? Douglas's voice rose sharply. That's corporate sabotage. No, Richard corrected firmly. That's responsible governance, something this board appears to have been prevented from exercising. Mark Daniels, looking increasingly uncomfortable, addressed Douglas directly. Why weren't these concerns brought to the board? Because they're overblown, Douglas insisted. Every launch has last-minute jitters. The team was being obstructionist. That's not true, I said, opening another file. This is Dr. James Harrington's letter, the Chief Medical Officer at University Medical Center, our primary beta testing site. He explicitly states that the accelerated timeline contradicts all previous agreements and raises significant patient safety concerns. As the board members read the letter displayed on screen, I watched Douglas calculate his next move. The confidence that had carried him through years of taking credit for others' work was visibly faltering. Even if there are legitimate concerns, he tried, his tone shifting to one of reasonable compromise. Replacing the entire technical team was clearly an overreaction. I acknowledge that. We can discuss reinstating key personnel. That's not going to work, Douglas, I said quietly. This isn't just about the team. It's about a pattern of behavior that culminated in firing your co-founder while she was fighting for her life in a hospital bed. The room grew uncomfortably quiet. Every eye turned to Douglas. That was unfortunate timing, he stammered. A difficult business decision that coincided with your illness. Nothing personal. Nothing personal? Nina repeated, incredulous. You fired your co-founder and COO during critical sepsis treatment, then misrepresented her departure to the board as voluntary. Now you're attempting to rush an unfinished medical product to market while dismissing the team that built it. All to secure funding before anyone could challenge your actions. Douglas turned to Mark, his most reliable ally on the board. This is clearly a coordinated attack. We're about to secure $40 million in funding that will transform this company. Are we really going to let personal grievances derail everything we've worked for? Mark looked troubled. I'm not sure this is just about personal grievances anymore, Douglas. Dr. Winters nodded in agreement. I believe we need to vote on immediate actions, starting with halting tomorrow's deployment, regardless of the court's decision on the restraining order. Douglas's face hardened as he realized his support was crumbling. If we delay the deployment, Carrington could pull their offer. Everything we've built could collapse. Everything we built? I repeated, emphasizing the word. You mean everything I built, while you took the credit? Douglas's expression darkened. That's not fair. I've been the face of this company, securing the connections, the funding, while systematically erasing my contributions, I finished. But this isn't about credit anymore, Douglas. It's about patient safety and ethical leadership. I turned to address the entire board. We have two paths forward. We can rush an unfinished medical product to market under the current leadership, risking patient safety and potential liability. Or we can pause, address the technical concerns, and consider a superior funding offer that would strengthen rather than compromise our mission. Richard nodded. I propose we take a formal vote on 3 immediate actions. First, halting tomorrow's deployment. Second, authorizing discussions with Horizon Ventures regarding their offer. And third, addressing the leadership situation that led to these concerning decisions. Douglas slammed his hand on the table. This is a coup. Elsie gets sick for 2 weeks and comes back expecting to take over the company I've been running for 5 years. The moment the words left his mouth, I knew he'd made a fatal error. His mask had finally slipped, revealing the truth he'd been hiding, that he viewed Healthcrest as his company alone, despite everything I had built. Dr. Winters raised an eyebrow. I believe you were co-running the company, Douglas, with the person you fired via email while she was hospitalized. The room fell silent. Douglas realized his mistake too late, his expression shifting rapidly between anger and attempted recovery. That's not... I didn't mean... He took a deep breath, visibly, struggling to regain composure. What I meant was that major changes in leadership during this critical funding phase could destabilize everything. More destabilizing than firing the entire technical team right before a product launch? Richard asked dryly. Mark Daniels, who had been quiet for some time, finally spoke up. I think we need to be practical here. Patient safety concerns aside, and those are significant, we have 2 competing funding offers. One at $40 million with a rushed deployment timeline, the other at $45 million contingent on leadership changes. He turned to Nina. Could you elaborate on what leadership changes Horizon envisions? Nina nodded. Our investment would be contingent on Elsie Mitchell assuming the CEO position, with a restructured executive team focused on both technical excellence and responsible business growth. We've observed that the company's most valuable innovations have stemmed from her leadership, while its current challenges appear to result from decisions made without her input. This is outrageous, Douglas sputtered. You can't seriously be considering... We can, and we are, Richard said firmly. Let's proceed with the votes. The first vote was unanimous. Even Douglas, seeing the inevitability, reluctantly agreed to halt the next day's deployment pending further technical review. The second vote, to authorize formal discussions with Horizon, passed 4-1, with only Douglas dissenting. Then came the third vote. Richard stated it clearly. Motion to restructure company leadership, with Elsie Mitchell assuming the role of CEO, effective immediately. Dr. Winters voted yes without hesitation. Richard followed with another yes. All eyes turned to Mark Daniels, traditionally Douglas's ally on the board. Mark looked at Douglas, then at me, then back to Douglas. I have a fiduciary duty to this company, he said slowly. Based on the evidence presented tonight, the rushed deployment despite safety concerns, the termination of key personnel without board notification, and the misrepresentation of Elsie's departure. He paused. My vote is yes. 3-1. The motion had passed. Douglas stared in disbelief. You can't do this. I founded this company. We co-founded it, I corrected quietly. And the board has spoken. Richard turned to Douglas. I think it would be best if you stepped out while we discuss transition details with Elsie and the Horizon team. For a moment, Douglas looked ready to explode. Then, with visible effort, he controlled himself, gathered his things, and walked stiffly toward the door. At the threshold, he turned back. You'll regret this, he said, his voice cold. All of you. Then he was gone. As the door closed behind him, I felt a wave of emotion, not triumph or vindication, but a profound sense of responsibility. This wasn't just a personal victory. It was a chance to right the course of the company I'd helped build, to ensure our technology fulfilled its promise to help patients rather than endangering them. Well, Richard said into the silence, I believe congratulations are in order, CEO Mitchell. 2 months after that pivotal board meeting, I stood in the doorway of what had once been Douglas's office, now mine. The space had been transformed, not just with different furniture, but with a different energy. Gone were the intimidating dark woods and imposing desk that had separated Douglas from everyone else. In their place was a more open arrangement with a round meeting table beside the traditional desk, glass walls that could become transparent or opaque as needed, and most importantly, a door that remained open more often than closed. My first official act as CEO had been to reinstate the technical team, calling each member personally to apologize for what they'd experienced and invite them back. All but one returned, bringing with them the institutional knowledge and commitment that had been instrumental in building our products. Blake and his hastily assembled replacement team were gone by the end of that first week. The second act was to establish a clear deployment timeline for the AI diagnostic system, with proper testing protocols and safety checks built into each phase. We'd just completed the first successful implementation at University Medical Center, where Dr. Harrington reported that the system had already identified 3 early sepsis cases that might otherwise have progressed to critical stages. Before detection, life-saving technology, deployed responsibly. Nina Reynolds and Horizon Ventures had proven to be the partners we needed, focused on long-term value rather than rushed timelines, understanding that healthcare technology required both innovation and caution. The series. C funding had closed smoothly, providing us with the resources needed to expand thoughtfully. Douglas had not gone quietly. There had been legal threats, attempts to rally support from industry contacts, even a few bitter LinkedIn posts thinly disguised as lessons learned in leadership. But without access to the company's code or customer relationships, his leverage had quickly diminished. Last I'd heard, he was trying to start a new venture in the healthcare space, but struggling to find technical talent willing to join him. My health had fully returned, the sepsis now just a memory and a cautionary tale I sometimes shared when explaining the mission behind our diagnostic system. The irony wasn't lost on anyone that the very condition our technology aimed to detect early had nearly killed the person who created it. "Excuse me, Elsie?" Maggie appeared in the doorway, tablet in hand. "The executive team is ready for you. In the conference room, monthly product review in 10 minutes. Thanks, Maggie. I'll be right there." She smiled and turned to go, then paused. "Oh, and Adam says the new machine learning model is showing promising results. 15 minutes faster detection time in simulations." I nodded, feeling a familiar thrill of achievement. 15 minutes might not sound like much, but in sepsis treatment, it could mean the difference between full recovery and lasting organ damage, or worse. The executive team that awaited me in the conference room looked nothing like the one Douglas had assembled. Freddie had been promoted to Chief Product Officer, his deep understanding of user experience making him perfect for the role. Adam now led our data science division as CTO. We'd brought in a respected physician as Chief Medical Officer to ensure clinical perspectives always had a seat at the table. And Maggie had moved from HR to Chief Operating Officer, her organizational skills and institutional knowledge proving invaluable. This was leadership built on competence rather than politics, on shared mission rather than personal ambition. Azir. I walked down the hallway toward the meeting. I passed the wall where we'd hung our company values, not as meaningless corporate jargon, but as genuine principles that guided our decisions. Innovation with responsibility. Transparency in all directions. Credit where it's earned. Patient safety above market pressure. Simple concepts that Douglas had never understood, but that now formed the foundation of everything we did. The path from that hospital bed to this moment hadn't been easy. There were still challenges ahead, technical hurdles, market pressures, the constant balance between growth and quality. But now we faced them as a unified team rather than as competing agendas. I paused at the conference room door, watching my colleagues engage in animated discussion about our latest projects. This right here, was what winning really looked like. Not revenge or vindication, but creation. Building something meaningful with people who shared both the work and the credit. "Ready to start?" Adam asked, noticing me in the doorway. I smiled and took my seat at the table. Not at the head, but among them, where leaders belong. Absolutely. Let's begin. If there's one thing I've learned through this entire experience, it's that sometimes your greatest challenges become your greatest opportunities for transformation. Being fired while fighting for my life didn't just change my career trajectory, it changed how I understand leadership, loyalty, and my own worth. For years, I'd defined myself by what I created rather than by who I was. I thought my value came from the code I wrote, the systems I built, the problems I solved. I was content to stay in the background, to let others take credit as long as I could keep building. I believed that good work would eventually be recognized. On its own merit, that fairness would naturally prevail in time. I was wrong. In professional life, as in health, symptoms of dysfunction don't resolve themselves if ignored. A toxic leadership dynamic doesn't improve without intervention. Systematic. Erasure doesn't spontaneously transform into proper recognition, and a person who values credit over contribution will rarely change without being forced to confront the consequences of their actions. The thing about being pushed to your absolute limit, whether physically by sepsis or professionally by betrayal, is that it strips away pretense. In that hospital bed, fighting an infection that was trying to shut down my organs, I couldn't maintain the fiction that everything was fine at work. I couldn't tell myself that Douglas's gradual rewriting of our company's history was just business, not personal. Near-death experiences have a way of clarifying what matters, of burning away the unessential. What remained after that clarifying fire was simple: the conviction that I would no longer diminish myself to make room for someone else's ego. The understanding that I had built something valuable and deserved to lead it. The knowledge that leadership isn't about taking credit, but about creating conditions where everyone can do their best work. Some might look at this story and see it primarily as one of justice served, the wronged co-founder reclaiming her rightful place. But I see it differently. This wasn't about getting even with Douglas or proving myself right. It was about aligning leadership with values, about ensuring that life-saving technology was deployed responsibly, about creating a company culture where innovation and ethics could coexist. The truth is, I'm a better CEO today than I would have been before all this happened. The experience of fighting for what's mine, not out of greed, but out of responsibility to the technology and the team, transformed me from a technical expert into a true leader. One who understands that her voice matters. One who knows that technical excellence without ethical backbone isn't enough. One who recognizes that sometimes the most important thing you can build isn't a product but a culture. If you're in a situation where your contributions are being minimized, where your voice is being silenced, where your work is being claimed by others, don't wait for fairness to find you. Don't hope that eventually someone will notice and make it right. Speak up. Document everything. Build alliances with people who value truth. And most importantly, know your own worth. Not just what you can do, but who you are. Because sometimes, the journey from hospital bed to CEO's office is shorter than you think. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.